In this week's muscle breakdown, I'm covering a very important group of muscles that are associated with unresolved neck pain, carpal tunnel syndrome, thoracic outlet syndrome, and a lot of just tension and overall dysfunction in the neck, the scalene muscles with the nerve roots. What's up, everybody? Dr. Matt Madger here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach massage therapists how to make well over $100,000 per year, all while working less than 20 hours per week by learning to work smarter, not harder. For our muscle breakdown, and today I want to be covering specifically the scalene muscles and when the nerve roots can get caught in there. This is a very common site for what's called a nerve entrapment. Nerve entrapments basically can occur at 256 different places in the body. It can cause a lot of problems, ranging from numbness, pain, burning, tension. And what happens is nerves are built with about 15% of extra slack to keep them really healthy, and a lot of times they get used up in through here. So with bad posture, looking down at our devices, not moving enough, what happens is these nerves get stuck in the muscles, specifically in the scalenes. Now the scalenes are classically three muscles. You have your anterior scalene, you have your middle scalene, and you have your posterior scalene. Now the most common area where I'm going to see what's called a nerve entrapment is between the middle scalene and the posterior scalene, specifically at the levels of the C5, C6, C6, C7, and C7, C8. And what happens is these nerves come out through the spine and then they go out and branch their way out. And what happens is they get stuck to the muscles in there. They get glued with what's called scar tissue. Scar tissue is like glue, makes the muscle weaker, less flexible. What happens over time is that scar tissue builds up more and more, and then that nerve gets stuck in there. And when the nerve is getting stuck, it can't pull and slide how it should. So a lot of times it's stuck up here, but you might get a client that's coming in with a complaint in the shoulder, down in the armpit. They might even be complaining of lateral elbow pain, carpal tunnel type of syndrome, or even a thoracic outlet syndrome as well. Another area where you can get some presentation in this is when the 5-6 nerve and the 6-7 is beat up. It can actually refer some pain deep in the shoulder blade as well. So the nerve can get caught in a lot of places, and nerve entrapments are a really big deal. And with modern society, being on our phones too much, looking down, these muscles just get really beat up, and then that scar tissue forms. So treatment, palpation of the scalene, specifically at the nerve root, is actually very difficult to do. It's hard to find, but if you can get in there and actually find it and fix it, it's going to help with a lot of those other problems that I listed before. Now, the key here is going slow so you can go fast, because these muscles are very tiny and they're very sensitive as well with the nerve roots in there. And what I find is that way too many practitioners get way too much compression on it and not enough tension. In order to break down scar tissue, you need proper depth, then tension. So what I want to include in this week's breakdown is me actually doing and demonstrating from one of our training modules in the Peak Method, effective palpation, how to find the nerve root and where the dysfunction is, and then applying what I call manual scar tissue treatment to break down the scar tissue between the nerve and the muscle. So I'm going to include that, and check that video out. We're going to be treating the nerve roots at scalenes. I wanted to show here with the model, just so you can get a better idea of how the setup is. The key here is we're only going to be going a very short distance, but when these nerve roots are really caught up and create a lot of problems with overall functioning of the neck, can cause some pain down the shoulder, back through here as well. So symptom location is really key. And when you're seeing a limited test, when they're doing that upper cervical functional test, what's going to happen is it's going to refer some pain there. So if you can clean these up, it's going to make a big difference. So coming a little closer here. So the way that I'm going to set up is you're going to have the client right here, and the top of their shoulder blades will be right off the edge of the table. And then you're basically going to have your hands cradled just like this. And this, say we're treating the left side, so the top hand is going to be our support hand. So what I like to do is I count some landmarks from where we go, and then down. So we go down here, and the first one you're going to find is at C7. So I want you to go 7, 6, 5, 4. And that's where you're going to hold and cradle. And it's going to go just like this. And then you're going to bring the other hand around just like that. And then everything is going to be nice and supported. And you're going to be able to fulcrum and open that up. Because what we're treating in here is these nerve roots, and the scalenes go over top. So this will really help you with the palpation. So we're going to create a fulcrum. You see how my hands are here, and what you're going to do is open it up just like that. you have a little bit of tension, and we're going to go in and feel on each one of these nerve roots, and we're going to find the area that's the least compressible because that's where that scar tissue is. So what you're going to do is sink in and see what you feel. So first you'll have the C5, C6, then you'll have C6, C7, and then C7, C8. Those are the three that you're going to work in there. So when you find the one that compresses the least, that's where you're going to want to treat. So the way the treatment is going to work, you're going to be in just like this, and what you're going to do is start them in neutral, and say we're going to treat the C6, C7. So we're right here, my thumb is here, and we're going to use the pads of our thumb to open it up this way. That's going to allow us to get in there. We're going to be nice and relaxed, and then the first thing we're going to do is we're going to get some depth with a pec push into there, and then we're going to come out just a little bit. Normally we come out 10 to 20% when we're treating just scar tissue, but since this nerve is here and it's deep, we're only going to come out 5%. Now the next thing you're going to do is you're going to get your tension with a body lean like that. You're going to get right over top of that, and you want to pause just before that happens and hold that. And the way the motion is going to work is you're going to take this left foot, and this is going to be your push foot, and your right foot is going to pull. So what you'll feel is a slight push and a slight pull as I bring it through just like that. And we're not going very far as we go through because we're only treating that one level as we go in there. And only treating that one level as we go in there. So this is actually going to be what's called that internal slide. So when you set it up just like this, you're here, your depth comes with your pec push, your tension comes with your body, and you're gonna push with that left foot and pull with that right, and you're gonna force that to roll over your thumb, but you're not gonna move your thumb, and it's gonna come from there. So I'm gonna show what it looks like on an actual client. So once again, positioning, you're gonna have them come to the edge of the table, just like that, one more scoot back. So their shoulders are here and their head's gonna be cradled in here. First step you always wanna do is have them tuck their hands under their butt. It's gonna help everything relax. So say we're treating that left side like we said, this right hand is gonna be there. We're gonna go in and count. We're gonna have C7, C6, C5, C4. I'm gonna create that knife edge and just hold there and see how it's nice and supported there. From there, and now the next one we're gonna go in and we're gonna start to palpate those different regions. So we wanna use this thumb as a fulcrum to open it up as we're palpating. And we're gonna sink in first, and that's 5, 6. Just push with that pec and see, is that compressing or not? Then work our way down. That's 6, 7. And then we're gonna go 7, 8. In whichever area feels like it's not compressing enough, that's where that scar tissue is. So let's say this one's at C6, C7. I'm gonna start here nice and neutral. My arms are nice and relaxed on my side. And what I'm gonna do is take this right hand and push it into my left. That allows my thumb to sink in there nice and easy. Then what's gonna happen is I'm gonna get some depth by pushing with my pec, and my tension is going to be that body lean. And I'm gonna be nice and loaded, and as we said, I'm gonna push with this left leg and pull with the right, and we're gonna go nice and easy, and I'm gonna keep that pressure and that tension and let that slide over my finger. I'm not sliding my finger, I'm letting it come to me because that is internal slide, not external slide. So the key is palpate it under tension. Once it's there, you're gonna fulcrum that in, nice and relaxed, and you're gonna get that pec push for your depth and a body lead for the tension. And then you're gonna push with this left and pull with that right and have it go through just like that. Good. Hope you enjoyed that video and hope you got a lot of good information out about that. So the take home from that video, as you can see, is that how slow and precise I am with my system and my treatments. You know, so many practitioners go in there and they just want to hammer away. They want to get their hands on everything. I say that's a very shotgun approach. In my system, the peak method, we do what's called a sniper approach. We ask the right questions, we do a very detailed functional evaluation, detailed palpation, and then I know right where to go. And then we can consider ourselves a sniper approach because we can go in there and effectively treat it. So if you're rushing, you're trying to get in there really quick, you're putting too much pressure, especially around the nerves, all you're gonna do is piss that muscle off. It's gonna hurt like hell for the client. You're not going to be able to get an effective treatment. So much for watching the video. If you like it, give it a like, a comment, a share. And if you got any specific muscles or injuries or any questions you have for me, just send me a message and let me know, and I'd love to cover it on our channel. If you haven't got the free training yet, the free training is awesome in my method. You can find that wherever you're consuming this content. Go out there and get that. And thanks so much for watching, and I'll see you on the next one. Bye.